Welcome to Recovery Corner, where the many pathways of recovery intersect. This is a space where you will hear personal stories of triumph in recovery, gain insights into various recovery-oriented systems, and learn how leaders across the country are building recovery-ready communities. The Recovery Corner podcast does not provide clinical advice.
Hey friends, welcome to the Recovery Corner podcast produced by young people in recovery. It's an exciting day. We're continuing on with our Recovery Stories project, where we have authentic and vulnerable and informative conversations with people about their leadership in recovery. Our intention today is to provide inspiration and new ideas to help support you on your recovery journey. Our goal is to help generate new insights in your life for your journey and your healing journey and your recovery journey, and to also provide some tools and ideas to support you. So welcome aboard. My name is Brian Knuckles. I'm a staff member here at Young People in Recovery and also chapter lead in Pittsburgh. And I am here today with my wonderful co-host, Carly. Say hello to the people, Carly.
Hello, people. I'm Carly here in sunny San Diego. I'm also a chapter lead, and we're really stoked to be talking to Mr. Ben Durgan today. Our YPR, what's your official title? Senior Public Policy?
Not even senior, just Director of Public Policy. I don't want to put the senior on there. I'm not that important.
Okay. I guess there's like no one to be senior over.
Yeah.
You're just the guy.
I'm that guy. Yeah, I'm the guy.
Right on. You want to just give us like a brief intro of yourself?
Yeah,
Ben?
sure. My name's Ben Durgan. I am based in South Florida, Palm Beach County, Delray Beach. Graduated from Florida State University in Tallahassee, Florida. Did about 5 years in the Florida Senate with some of my local state senators. And then I did some advocacy and lobbying for some of our associations here in Palm Beach County. And then I joined YPR late last year as their public policy director, and as someone who has a parent who's 40 years in recovery and having a lot of friends in the recovery community and losing a lot of friends, I think it was a God job in terms of how YPR and I lined up, knowing that I wanted to do something that was very close and passionate to myself on the public policy realm. So we married, and it's been a beautiful journey thus far. I look forward to what we're working on. That's a little bit about myself. Let's get it going.
Yeah, let's jump into some questions, Ben. Thanks for that introduction to your work and your experience and some of your goals and with the position at YPR. And I'm curious. So our topic today is advocacy. So my first question that I was thinking of is like, what's exciting you and like animating your life right now when it comes to advocacy and recovery?
I think I'm an optimist. I know we see a lot of pessimism in our world nowadays, but I'm an optimist by nature. And I think that with the current climate we're in, I think there's a lot of opportunity, not just for YPR, but for the recovery community in general, to not just advocate, but more importantly, educate. And like that's going to be a common theme that I talk about. And I say that because, I think we can all agree that there is a longstanding stigma on addiction and people that struggle with substance use disorder. And I think a part of not just YPR's mission, but in terms of the public policy realm, a part of that is educating our elected officials and our influencers and how they frame and how they view the disease. And so I've met with several of our national partners, Face and Voices, and I think there is a lot of opportunity for us, not just to work on some national policy, but to really sit down with some electeds one-on-one and just tell stories, like tell our narratives, right? Because I think in our community, the most powerful thing that we have is our individual stories. And since I came on to YPR, I have heard super inspiring stories and a lot of hope. and a lot of great stuff that we can take and we can use in our advocacy movement. So, I mean, I'm excited just about talking to our YPR members and hearing their stories.
Awesome. Yeah, I just want to add that like I've known you, Ben, and worked with you for like just a few months, but you just came in the door like ready to go and like ready to change stuff. Change, like I am definitely not the most I don't know, educated in terms of policy, advocacy, etc. But like I think it's, you know, just that energy is palpable. And I think like organization wide, our chapter leaders and our members like can feel that, and we really appreciate it. So yeah.
You know, just to add on there, Brian, you know what, that's important. Here's why. I was born and raised in Delray Beach in Palm Beach County, and the only reason why is that my mother came down here to get treatment. She was at her lowest, and you know, by the grace of God, she just, you know, picked up 40 years clean and sober and beautiful as ever. But I think about that because I am so grateful that I was raised by a mother when she was sober, right? Because a lot of people, a lot of our members, a lot of people out there have parents that you know are using and have SUD and are raised that way. And I'm just so blessed that I was, you know, being able to be raised by someone, you know, that has been in recovery and long-term recovery and has a strong recovery. And everyone's recovery is different. I think we can talk about that later, but I'm very blessed. Thanks for bringing that up.
Nice. That definitely kind of like ties it in a little bit more. I didn't know that about your story, but let's get into advocacy. And this is a good question for me to ask you, because I can honestly say like I still don't fully understand. How would you define advocacy for me and our listeners who are like, what the heck?
We got a bunch of this is the most loaded question on the list, and but it's an important, but it's an important question, so I'm going to answer as best I can. As someone who has worked in the process, a big part of the word advocacy is education, and I'll give you an example. I worked for a state senator in Florida here, and in Florida, working for this elected official. We were dealing with all sorts of policy issues, you know, housing, education, transportation, water. You know, there were a host of issues. And the issue there is that we can't be experts on one thing. So we need to rely on other people to educate us on specific issues so we can go advocate on our behalf. So when I think about advocacy, if we're talking about YPR and people in the recovery community trying to do that, I think it's two things. I think it's one, educating, having your facts, talking to your elected officials, whether it be congressperson, state elected, county commissioner, municipal elected, educating them on the specific issue at hand. But more importantly, how you tie that in is a personal narrative. I call it a story, right? I've heard plenty of people working for an elected that just spit facts and it gets boring over time. When people tell a story, you can connect with them on a deeper level. Then you can work on the advocacy part. So I think when we look at the word advocacy, like there's the education piece, but then there's also the personal narrative piece, right? And I think you marry them both, and that is the perfect concoction for a beautiful advocacy push.
Nice one. Good. Yeah, totally. Totally. Yeah. Really beautiful way of putting it, Ben. And the question was kind of exploding off my lips as you were talking, because you have already told stories today. I'm noticing that as you're educating us about advocacy, telling like your family story. And I'm wondering now, kind of to Carly's question a little bit, bouncing off it, like how can we connect this education and advocacy with recovery? What's our path forward for doing that?
Yeah, and honestly, that's a good question, because I think when we work with our partners and we start as an organization and as chapters, we start talking to other people, other organizations. There's a lot of different avenues, right? Like we have the prevention avenue, we have the harm reduction avenue, we have the treatment avenue, and then there's the recovery avenue. And I think what we've seen, at least in the media and on the news, is that there's been a lot of attention towards the prevention, the treatment side, harm reduction, and recovery doesn't really get talked about enough. And what I can tell you is that prevention, treatment, harm reduction, that helped save my mom's life, but she became a beautiful mother and a beautiful person in recovery. Right. And so what does that look like? Right. So obviously, when you get into recovery, you can't do it without a support group, right? Doesn't matter if it's 12-step, whatever that is, you need a community, right? Like you need people to really empathize with you and your feelings, because it's hard, man. I've had friends that are in deep addiction that I've empathized enough, but at a certain time, it can be difficult. And so I think, in terms of recovery, first off, the 10% set aside should be a guarantee if we're talking about policy, right? If we're giving out block grants to certain entities, there should be a set aside for recovery, whether that's peer support specialists or all of that, because think about it. If you're someone that is trying to get help for SUD or is in recovery, you're going to open up and bond with someone who looks like you, who can understand you, who can empathize with you, and who shows that real compassion. And I've dealt with some peer support specialists. Like there's certain avenues in recovery that we can, deal with on a policy level and fund with our dollars, because, there are a lot of dollars out there. We just need to make sure they fund and they go in the right way. But I think at the end of the day, like I always tell people, there's a macro level and there's a micro level, right? We talk about the macro, right? Like that's the sexy thing we hear in the news. Like that's what we hear. The micro level is the hardest thing, because the micro level asks people to change, and change is hard. Change is very hard, especially with our people that are in recovery. And it asks people to change their hearts and change their minds. And we have to look at people with complete empathy and compassion. And that takes work. So in some ways, in our communities and our chapters, we're doing a lot of great work there, right? But when we talk about changing hearts and minds, or elected officials talk about that, it's much deeper than that. And it happens at a micro level, not the macro level.
Interesting. I feel like you kind of already have answered this next question based on that response. But maybe you can go in a little bit deeper as far as how do policies and systems actually create barriers to recovery, policies and systems, and how we can dismantle some of those.
Yeah, sure. So, with my experience in government and state government, over time, over 5 years, I've seen state governments, elected officials pass laws that at the time were well-intended. There was good intent behind it. But I think sometimes they forget that, when you're passing a state, when you're passing major policy, there needs to be a lot of feedback and a lot of conversations with other groups. And what happens is, whether it be at the federal or state level, it doesn't matter what level it is, they pass legislation. And what happens is they come back and they're like, oh crap. There's, 1, 2, 3, 4 issues, especially when you're talking about major issues such as, addiction and recovery policy. I also think that unlike cancer, diabetes, addiction carries a much different stigma. And because of that, and not ill-intentionally, I think because of that, whether it be our elected officials, community members, or other individuals, in their minds create a different idea. And on the micro level, that creates barriers there, right? On the bigger level, whether it be at Congress or in California or in Pennsylvania, you might have some elected officials that pass a bill related to harm reduction that they think is good, but a year or two later, we find out, oh, well, it's negatively affecting, so-and-so, communities. So, when we're talking about like major policy issues, honestly, the major barriers are really educationally based. I mean, if I could talk to an elected official or an administrator, a regulator, or someone in charge of an agency, hey, here's what we're working on, and here's why, and they could understand what I'm relaying to them, some of these things, might not happen. And you might think it's funny, but it's almost as easy as that in certain states. And so I think that there are a lot of barriers, and there's money barriers, right? I mean, money talks. I mean, we live in, we have a democracy where, let's just, keep it honest. I mean, we have, whether it be, the healthcare industry, which does a lot of great things, pharmaceutical industry does a lot of great things. We live in a world where, there is a potential, struggle there, and how can we meet in the middle, compromise, right? And so there will always be barriers, right? And I think when I came into YPR, a part of my mission was to educate our chapters and our members, and then teach them how to tell their stories and lobby and advocate. And I'm here to support them. But, to your question, the barriers will always be there. It's about building a strategy to let them stay there, but how do we get our point across?
Yeah. Can you, before we get into Brian's next question, just like when you talk about, you can talk to your elected officials and so, like literally, how would somebody who has no knowledge of advocating, working in public policy, how do you even get in touch with these people? How do you share your stories, like literally?
Okay. Well, you want me to run through like a real life example?
Sure.
All right. So who's your elected official? Do you even know your elected official?
No.
No. Okay. Fair enough. Most people don't. So I'll give you an example. In Colorado, they're working on the Good Samaritan law.
Yeah.
Right. So I've talked to a couple of our chapters in certain counties. Let's just use Adams County for an example. If I'm talking to one of our chapter members, I'm like, okay, you're in recovery? Yes. Get to know your story. Okay. Here's your elected official. Here's his district office. Here's what it is. Reach out to his aide. Find the email address. Say, hey, I'm so-and-so. I'm with this organization. Would love to talk to you, not just about this specific Good Samaritan law, but, just to get to know you. You're my elected official. They will never say no. Never say no. So, start with the staff. Meet with the staff. Tell your story. Do all that. Love to meet with the elected official. And eventually, you will get to them, because I've worked that system. But here's where it matters. You're meeting your elected official in your county. You're not just traveling to the capital, which is important, but you're meeting him in his own place. When you meet an elected official in his own district, he feels comfortable. He doesn't feel on edge at the capital when he's on edge for someone to kind of, throw something at him. But when you do that, you start to build rapport. You start to build trust, right? I'm here talking to you about an issue. We're good. And I'm on your home turf. I appreciate you meeting with me. You start to build that relationship over time, right? And I always say advocacy is a long game. Like there's really no short game to it, right? Like that's not an answer. No short-term answer is the real thing. And so, if I'm talking to somebody in Colorado working on this law, didn't pass, start to talk to your elected official on the off season, I call it, when they're not in session, and say, hey, my chapter, my community, in the recovery community, takes issue or supports this bill because of such and such. And you start to talk about that. So next year during session, when it comes up again, you're not just some random person. He knows you and he has that relationship and he trusts you. And let me tell you something. I've had this happen to where my elected's been like, I know them, I trust them, I'm flipping my vote. It happens. And that's when I talk about that personal narrative and that connection. Like, I think the one thing we have to talk about is that people think elected officials are these like demigods that, are up here and they can't talk to them. Newsflash, they're normal people. They're just like me and you. Shit, some of them have the same, deal with the same issues that we do. They are no different than any of us. And so when I talk to our members, our YPR chapters, don't talk to them like they're up on a pedestal. Talk to them like you're talking to your parents, your friends. They're one of us. They're just people. And I think, on a micro level, we have to keep that sense of connection there,
Thanks for demystifying that a little bit.
Yeah, they're just people.
Yeah.
Yeah, it's super helpful, Ben. Yeah, and I'm really appreciating and noticing in our conversations so far how you're really focused on, you've drawn this distinction between like the macro and the micro. And in almost all of your questions, you've brought up like relationship building, like building strong relationships. And so I'm wondering how that will land with this question. So I'm wondering about, we hear this thing when I'm reading about advocacy about like system change and like looking at the root cause and not the symptoms. And so like, what do you make of that kind of idea? It's a bit of a vague question, but like connecting with the macro and the micro, like how can our advocacy efforts focus on root causes, or should we even be focused on that? Like, how does that land for you, this root cause or symptom idea?
So, as being someone as a family member who is in recovery, I've been to a lot of meetings to, support my family and my friends. I think that's an important question. It's a difficult question to ask, but at least what I've seen from my point of view is that recovery is very difficult when you're trying to do it by yourself. And you don't have I say a support system, but you don't have people that can really understand, right? Like, I till this day, I have regrets about friends that, were struggling with SUD, and I just couldn't really empathize because I wasn't, there, right? And, I wish I could tell them different, but I can't. But, in my position here, with YPR, I look at our mission, and Brian, how many chapters we have? We are growing.
57.
Yeah, 57 and growing. And there's not a lot of organizations that do what we do, right? And when I came in and I talked with Ann, some of our people, I stated that any change that YPR can make on like real lives will always be done at a state, more importantly, a local level, right? Like, you can't help someone in recovery on a Zoom meeting, right? You got to be there with that person when they're at their, when they're at their lowest. And I say that because, I've been that person. I've been there. And, I think that as much as we could talk about policy, and I think that's important. I think YPR through our chapters and through our platform, we're going that way. In my position, I will always stress we need that bottom ground communication with our people, because that's what's going to save lives. Because at the end of the day, like, that's what we're here to do, right? Like, we're here to help people save their own lives through our programs and through what we do. And I think, in terms of advocacy and policy, it might take some time. You might not see a success for a year or 2 or 3, right? But if someone's going good in recovery for a year or 2, you're not just going to give up because you don't see the light, right? Like, you're going to keep going because they take it one day at a time. And that's how, that's how I see our work, right? And I advise our chapters, and we do that. And I mean, Carly's, kick ass in California. Brian holds down PA. I mean, we have some really good people. And I think people at the end of the day are more important than policy sometimes, because I can give you a policy, but if I don't have Carly or Brian to take that and push it on the ground, it's nothing. Brian's got a story. Carly's got a story. That story matters. And telling that story to whatever official it is, that's how they connect. Like, oh, those dots connect. And you'd be surprised how beautiful it is when they do that. And I think YPR's power is in our people.
I agree 100%. I really prior to working with YPR, I've been in recovery longer than I've worked with YPR, but I obviously did service work and stuff as part of my recovery, but I never, or maybe I had goals for I teach a free yoga class, but I never prior to YPR, I never really had a platform necessarily to bring my message to people in a way that's not really just about me, but the message of recovery. And I think that's one thing that YPR fills this gap that I don't really know any other organization that I can think of.
Yeah.
That's this platform of recovery that we can talk about recovery out loud.
Yeah.
And I know for a fact that's why a lot of our chapter leads do YPR, some of our volunteers,
Yeah. And to piggyback off that, I can tell you, whether you're in a 12-step program, a 12-step, you're giving back. It's service, right? I mean, a lot of my friends, my closest friends, my parents, they sustain their recovery through helping others, right? Yeah. And I think that not just our members do it on an individual level, but we found a way to do that for the broader communities that we serve. And I think our advocacy platform is figuring out a way to partner with others to do it at the federal level and at certain state levels. And, I think in our conversations, I think the one thing that YPR does that no one else does is that we have so many chapters and we're so community focused. And let's be honest, Congress hasn't been the most functional, government institution the past couple, let's be honest. And so when you look at real change, it happens at the local level, because at the local level, our people are there. And whether they're, intimidated or, they're afraid, they have a story. And my role as policy director is to help them take that story and build it in to an advocacy pitch and platform, right? Because that's where our power is as an organization. And I want to align it to where their power is and their story, right? I mean, I think, I have a friend who's in long-term recovery, and he's a beautiful person and he has completely changed his life around. And I'm like, dude, your story matters. Your story matters because there's someone out there that is afraid or is wants help but won't do that. And I think that our chapters and our organization is there to say, hey, brother, sister, come in. Like, we're here just to listen and help, you know?
Yeah. And we have a whole network of resources, and
Yeah.
it's really cool. Yeah.
Yeah, it's a beautiful
All
thing.
right. This is, again, I think something you've touched on, but maybe you can get a little more specific. What role do policymakers, healthcare providers, and other stakeholders play in advocacy and the recovery process? And how can we build stronger partnerships between these groups?
It's a good question. So I think it's already been happening. So when we talk about changing policy, you have policymakers, right? They file the bills, they vote, you know, they do what they have to do. But let's say we're talking about a funding issue or a specific policy issue, whether it's related to, you know, example, fentanyl testing strips or telemedicine, whatever that issue is. Usually when they move that bill, they say, hey, healthcare providers, treatment centers, like they bring all the parties in here and say, hey, this is a major piece. We want to have all the feedback, or at least that's how it should go normally. Right. And I think in terms of recovery, you know, healthcare providers need to be there. The treatment centers do. But I also think that you have to have people on the outside, peer support people, you know, people that aren't healthcare providers, quote unquote, but are in recovery. Because what I can tell you is that those are the people that are going to be able to communicate one-on-one with people that are struggling with the SUD, because there's a trust factor there, right? Like sometimes people don't trust doctors. All right. You know, we've all lied to doctors before, right? I mean, you know, so, you know, but, you know, I think that trust factor on a individual level is, you know, is important. And so I think through YPR's work with Faces and Voices, Shatterproof, and some of the other medical associations, I think we're starting to work on, you know, some good things funding wise, because, you know, there's a budget every year, so we can lobby for those. Some of the policy stuff might, you know, take a couple of years, and that's fine. But I think what YPR has done that's been a great thing on a federal level is that we've partnered, you know, because at the end of the day, it's all better in numbers, right? We're stronger in numbers. And so I think that YPR, even before I've got here, has done a better job of collaborating with other organizations. So whenever those funding issues or these policy issues do come up, we're united. Because, you know, we're not as big as cancer recovery or diabetes. You might not have as much money, but that's not important. What is important is, like I told you, is we have stories. Like, I mean, we got miracles. Let's be honest. People in recovery, I mean, they are miracles. Okay. They are miracles. And I think, at least for my role, it's my job to take our little YPR miracles and help them put themselves on a pedestal to advocate and relay their story and talk about these policies and how it will affect, you know, our communities. Because, you know, I mean, let's use an example. I mean, fentanyl hit the scene probably 10 years ago, right? We've all lost someone to that, but there's always something new. There's tranq. There's, you know, there's always there, and it's ever evolving. So we have to kind of ever evolve our strategies as well, not just as a nonprofit organization, but also as a government too, you know?
Absolutely.
Listen, YPR, we are in a great place to do a lot of great things. And honestly, it's all because of our chapters and our people. Like I came in on, you know, as a, you know, the director of public policy. The first thing I did was I called you, Carl. I talked to Brian. I talked to all you guys, because I said at the end of the day, like, these are the people that have a pulse on the ground, right? I mean, like, if we don't have their buy-in, we don't have anything. That was a very important thing when I came in, because listen, at the end of the day, we do all this, but we serve our chapter members, and we do that, right? Because we're the ones that ask them to go out and do their advocacy initiatives or go and do this. And I think we all want them to know that we got your back, and we're here to help you any way we can, right?
I feel like for anybody listening, if they've made it this far, like this is a great place to plug if we haven't already been doing so. Like, if you want to share your story, you want that platform, you want to advocate, you want to see change happen in your community, like Ben is a person to connect with. Why, like our organization, if you're not already a part of it, you know, we want more chapters. We want like to get people involved, and like the feel good benefit of that is like worth every second. Like I would work for YPR even if I wasn't getting paid to do this stuff, because we're just like so open to all.
So would I.
Yeah.
I'm sure Brian would ditto that. And, you know, Carly, I think you're right, because, you know, sometimes telling your story in certain situations is a difference between life and death. And I don't say that lightly. I really don't.
100%.
And I think we've all seen the dark side of the disease, and what it's done to not just people, but families and all of that. And, you know, it's, I think when we talk, you know, we talk about advocacy and lobbying, but when we talk about, you know, addiction and then recovery, you know, addiction is something that doesn't just ravage the individual, but families and other people. And it's a unique thing. And I think, like I told you at the beginning of the cast, like, it takes a real education piece, right? We've been educated on cancer, diabetes, we know that. But I think our recovery community has a tough task. But I think, and it's not just YPR, it's the recovery community, but I think we're in a good place. And I think that, you know, past 10 years, our country's been ravaged by the opioid epidemic, and we've seen that play out in all communities, all of our chapters. And now we have an opportunity. And on the advocacy piece, my job is to take our people and raise them up and put them on my back. If I have to, I'll do whatever I have to do. That's my job.
You know what, Ben?
That's my job.
Yes. You know what, Ben? I'm thinking back to before we met, and I'm trying to remember, this is less of a question and more of an observation. I'm trying to remember like some keywords I would have thought about with advocacy. I would have thought about things like campaigns, strategies, writing letters, power, getting power, status,
Laws, rules,
regulations,
Persuasion.
Yeah.
persuasion. Yep. These are things I would have thought about. And since I've met you, I've now started to think more with these keywords: patience, humility, relationships. And then today, what was really coming through strongly is compassion.
Passion.
And it's really it's surprising to me how much that's coming through. And it's helping me bust some stereotypes I was holding, and exciting me about advocacy. So I just want to thank you for that and appreciate that in you.
Of course. And, you know, thank you, man. And, you know, it's not like I grew up with patience and compassion here. You know, it's a learned trait, but through my experiences in policy and politics, good and bad, and my experiences with people that I have in recovery and people that I've lost, you know, there are a lot of times where I wish I had my friend back to tell him this or tell him that. You know, there's a lot of regret there. And so I say that with a heavy heart, because I think we as a society really address intelligence by degrees or this skill set or whatever. But as a society, we really don't press the emotional intelligence part. And I say that because I have friends on Wall Street, I have lawyers, all that. And emotional intelligence, empathy, compassion, feeling people and listening to them is a skill set that the best in every trade carry. But as a society, especially when it comes to our community, they totally lack. And quite frankly, I used to lack it for a while. And the reason why I stress that is because I have that personal experience of people close to me, and I have to have that patience and that compassion. Even if I don't know what they're going through, I can have patience and empathy and compassion for them. And it's not just for our issues. I think at a higher level, we need to have, those values. But again, back to my macro micro thing, it happens at the micro level, right? It happens when someone comes to the Allegheny County All Recovery meeting and they hear a story and they're like, oh, I've heard that before. I have compassion for that person. That's how it starts. It starts small, and though, to me, those are the most important traits, especially in my work at YPR, especially there, man, especially.
Beautiful. Thank you, Ben. Thank you, Ben. You've been extremely generous with your time. I'm really grateful for it. We do have a traditional final question.
I mean, I can go all day, guys.
Okay.
Yeah, this guy can talk.
What do you think, Carly? What are we missing? What's a theme you're noticing?
I am really hearing just the power of stories to create understanding between anybody. Addiction is super stigmatized, and it still is. And I'm in recovery, and most of my people who are my closest friends are in recovery, and I still get frustrated, with people who maybe are still in their cycles of addiction, really.
Yeah.
But
and I get that.
It's, but it always comes back to that compassionate understanding. And for me, I have to remember what my journey looked like. And there's so much hope in recovery, and people just get it when they get it.
Yeah.
I'm not God. I can't put a timeline on that, but I can create resources and be a part of the change to make the community that they get to land in better and more vibrant when they do land in recovery, or they commit to it. And I can, be a message of hope to people, and I can show up in the middle of winter in cold San Diego weather. I have a yoga class for the people who come out, in the name of recovery. And if everybody just took that mindset, again, it's something I still really have to work on.
Yeah. And honestly, you're still in recovery, right? And you still have to work on it. We're human beings. We're just projects, and we're ever progressing till we die. Right. But I do think in the recovery community, and even people that are on that edge, I have a lot of friends that might have issues here, and they ask their questions, am I this or am I that? But I look back to someone who on the outside had everything. 6 figures, suit, car, had everything. But he was in a full-blown addiction, and I put him on my couch, homeless. I'm like, what are you homeless? It's and so guess what? All I did was that I just put him on my couch, and he was going through his recovery program. But you know what? Without even knowing it, you know what that gave him? It gave him hope. And I didn't know what hope was until I understood that when people are at their darkest moments of life, and I mean darkest, and I think both of you can relate, all they need is a little bit of hope. And that can be, hey, come stay here, or hey, this meeting, whatever that is. People need that hope. Hope can give people faith. And if people have faith, they can have faith in a brighter future. And I think that our chapters and are an example of that, right? I mean, we have people that are in recovery that are still in, but have made it out of that dark hole and have gotten that hope. So it's our responsibility at a chapter level, and even at, at my level, to give that hope back through our process, our advocacy process,
Absolutely. Yeah. Any opportunity we can get to help someone or give them a little hope is just such a beautiful gift. And I appreciate you giving that to us today, Ben. Maybe with our traditional final question, we have this idea of like leaving the audience with something they can take with them. So if you can think of a tool or a next step that you would suggest to our audience to get involved in advocacy, like what would you say?
That might be the hardest question you asked me, Brian.
Okay.
No, it's a good question. I think for me, what I've realized, not just talking to some of our chapter members, but other people, is that they just don't even know what's going on in their communities. Like, they don't know what their elected is sponsoring or doing. If you want to know about advocacy in general in your communities, honestly, it's just as simple. I mean, we got Google. Just go, who's my elected official in this space? What's going to pop up is Google News, what this person's doing, find that person, and just keep track of what they're doing. And it might not even be about recovery related issues, right? But if you're someone who doesn't have any advocacy experience, but is in recovery and is a part of a YPR chapter and wants to know next steps in their community, you go find all your county commissioners, whatever you're trying to work on, and start to have communication with them. And it doesn't mean them personally, it could be their staff or something like that. But if you're with YPR, our mission is to, not just, on an advocacy side, but more importantly, it's to, spread our programs and work with people in recovery, right? To make people feel more comfortable and help them on their journey. And, someone who finds that elected official and eventually after 6 months of communication gets to sit down with them, I can help them tell their story and their narrative to that person, right? And like, that's what matters, right? In terms of elected officials, because these men or women have a lot to deal with, but they always love sitting with constituents and hearing their stories. I can tell you that from experience. And I've also been there where I've spewed facts and all that, blah, blah, blah. They're like, all right, yeah, cool. Next, goodbye. Someone hears a good story, nothing can replace it. I'm going to tell you that right now. And I'm going to tell you something right now. All of our YPR members have stories and they're powerful. My job on an advocacy level is to help them raise that and give them the tools they need to go communicate that.
Wow. This has been such like a very inspiring conversation, and I feel more educated at the same time.
Well,
Yeah.
listen, like, politics is politics, right? But we're not in the business of, we're advocacy. Like, the politics of politics changes here and there, right? We advocate, and that message can be straight line and all of that. And, I learn all the time too, and I've been so blessed. It was a God job, the fact that I got to work for YPR, because, I worked in politics for a while. I didn't want to get back in here because I knew it was a lot of toxicity. And I said, if I ever came back, it has to be for something that I'm passionate about, that I can ride or die with to the grave. And this is something that I was like, okay, this is it, so let's go. But I also, we also have a team behind us, right, Brian? We got Amy, Jessica, like, we got a kick-ass team. We got a great team. And I wouldn't have joined if we didn't have this team. And we're super dynamic. And so I'm, building a platform where I can fit into what we're doing and help us build our strengths. And, we go from there. But The last message I have for, for our people, is that one, there's strength in numbers. YPR is strong for a reason. We have a strong community. But the second thing is that never forget the power of a story and a narrative. That's the strongest thing we have. That's how we communicate. When elected officials run campaigns, you see commercials, they try to tell a story. That's how they connect with people. And that's how we're going to connect with people and push our issues.
Thank you for that, Ben. And just a segue from that, I want to reach out to the audience listening. Definitely, if you're in this far, if you're an hour into listening to a podcast about recovery and advocacy, first of all, shout out to you for investing your time into healing and growth. And you definitely have a story to tell, and we want to hear it. And as Ben said, there's strength in numbers, and we want to welcome you to the YPR family. There is probably a chapter near you. And we have a national community, and you can find out about that on our website. We have national all recovery meetings, and we have rainbow recovery meetings weekly. We'd love to see you and hear your story and get involved with advocacy with you on all the levels from national, state to local. And so I want to thank my wonderful co-host Carly and our incredible guest Ben for their time today. And we'll see you everyone on the next episode.
Thank
Bye.
you, guys. Appreciate you.
Bye.
Bye, guys.